Hello friends, hi, good morning. Welcome to our channel The Voice of Nurse. Today we are going to discuss a continuous topic from the previous videos regarding model paper for staff nurse 2023. Today we are going to discuss part 3. Previously we finished two parts related to the model paper. This is second model paper. We already discussed first set of model paper in previously. If anybody not seen till now the model paper set 1, I will give a link in description. Please check it once friends. Today we are going to discuss a continuous topic from the previous video, model paper for staff nurse 2023 part 3. This is second set. In previous continuous classes we discussed related to the model paper, second set of model paper. In part 1 we discussed related to the questions 1 to 30 questions. 30 questions we discussed in part 1, and in second part 2 means in second model paper part 2. Previous class we discussed related to the model paper for staff nurses 2023 purpose. Not only the MHSRB, it is useful to all competitive exams related to the nursing, and also part 2 we continuously discussed related to the staff nurse model paper question number 31 to 60. 30 question we discussed in part 2. Till now we successfully finished related to the second model paper point of view, staff nurse 2023 exam purpose. 60 questions we discussed in previous classes. Today's class we are going to discuss 61 to 100. In this class, today's class, we are going to discuss 40 questions. One thing I want to say, each and every question is very important, and also if any question is repeated related to the first model paper, second model paper and upcoming third model paper, it is very important. That's why I am repeating question also. So please don't skip the video till end, just watch it and listen the class clearly. We are having very short time for the exams, so please don't skip the video. Before moving on to topic, a small request friends, anybody here watching first time my channel, please subscribe my channel, click on the bell icon for further notification, and please give a like and share the video to your friends. This is very valuable and important questions. That's why I am repeating regularly. Please share the video to your friends. Let's move on to today's class, model paper for staff nurses 2023 purpose part 3. Today's class we are going to discuss 40 questions. Question number 61. Hairline patch is most frequently associated with. Hairline patch is most frequently associated with. We will see here options. Option A, psoriasis. Option B, pityriasis rosea. Option C, erythema. Option D, rubella. Here what is hairline patch? A hairline patch is an erythematous 2 to 10 cm round to oval scaly patch or plaque with a depressed center and raised border that frequently presents days to weeks before eruption of pityriasis rosea. It is a common self-limiting papulosquamous disorder. Most hairline patch appear on the trunk, neck or proximal extremities, although in rare cases they have appeared on the face, genitalia, scalp and aerial surfaces. So here hairline patch is most frequently associated with pityriasis rosea. It is caused by a viral infection. The virus has recently been identified as one of the herpes viruses. Children and young adults are most susceptible for reasons are unknown. Pityriasis rosea usually starts with a pink or tan oval area, sometimes called as hairline or mouth patch on the chest, stomach or back. The main patch is usually followed by smaller pink or tan scaly marks elsewhere on the body, usually neck, back, arms and legs. Hairline patch is mostly frequently associated with the Pityriasis rosa. So here option B is the correct answer. Next we will move on to question number 62. Plato identified in. Plato identified in. We will see here options. Option A, relationship between body and mind. Option B, relationship between the body and life. Option C, A and B. Option D, none of the above. The Plato was convinced that human's mind or soul could not be identified with physical body. The Philebus Plato develops the language of as a way of characterizing the relationship between the body and mind. Plato believed that humans could be broken down into three parts. The first one is body, second one is mind, third one is soul. In the dualistic theory, Plato believes the soul is mind, comes from an eternally pure world of forms is ideas. Mind represents the soul. So here Plato was identified relationship between body and mind, or the relationship between body and soul. So here Plato was identified option A, relationship between body and mind. So here option A is the correct answer. Next we will move on to question number 63. A nurse suspects digoxin toxicity in a client when the client says, here the client says something in the following options. So the nurse suspects digoxin toxicity in the client. What is correct answer? We will see here. Options first. Option A, the light are very bright. Option B, I have no appetite. Option C, blood pressure is high. Option D, none of the above. Here, the digoxin toxicity common causes includes infection, renal failure and accidental overdoses, nausea or vomitings, neurological symptoms, early warning signs of overdose of toxicity means overdose of drug means here the main early signs of digoxin toxicity are anorexia, loss of appetite, confusion, nausea and vomiting, diarrhea or vision problems. Other signs like changes in heart rate, rhythms of heartbeat, palpitations or fattening. The most common cause of digoxin toxicity is hypokalemia. Due to the hypokalemia, digoxin toxicity will happen, which may occur as a result of diuretic therapy dosing errors. Also a common cause for the toxicity in the population. One of the most common cause is the correction of hyperkalemia due to the diuretic therapy dosing errors may be causes. So here when the client says I have no appetite means loss of appetite, complaints of loss of appetite, or I have no appetite means here the nurse suspect digoxin toxicity because of the early warning signs of overdoses is anorexia. So here option B is the correct answer. I have no appetite. Next we will move on to question number 64. Before giving CPR after ascertaining unresponsive one, what you should do? Here ascertaining a unresponsive one, before giving CPR, what you should do? We will see here options first. Option A, call for help. Option B, establish an airway. Option C, check pulse. Option D, start chest compressions. Here in CPR we are having 7 steps. In CPR we are having 7 major steps. Those are: first one, check for danger, call for help, then check the victim's airway, there is no respiration, give 2 rescue breaths, and start CPR. Switch roles with the compressors if available, and continue chest compressions until advanced medical help arrives. Give 30 compressions and 2 breaths. Aim for 5 sets of 30 compressions and 2 breaths means 30:2 in about 2 minutes. If 2 people performing CPR, give 1 to 2 breaths after every 15 chest compressions. Continue CPR until the medical team will arrive. So here for giving CPR, before giving CPR, after ascertaining a unresponsive one, what we should do means we have to check danger first. There is no check danger, means there is no check for danger in options. Second option is there here, call for help. So here option A, call for help, is the correct answer. Next we will move on to question number 65. Which of the following organ break fats to produce cholesterol? From the following, which organ will break fats to produce cholesterol? We will see here options. Option A, lungs. Option B, kidney. Option C, liver. Option D, heart. Here, dietary cholesterol helps to maintain a stable pool of cholesterol, but cholesterol is also synthesized by the liver. The liver breaks fat to produce cholesterol. So here liver is the correct answer. In detail we will see here, cholesterol is the principal sterol of all higher animals distributed in body tissues, especially the brain and spinal cord, and in animal fats and mostly oils. Cholesterol is a fat like waxy substances that helps our body make cell membranes. Many hormones and vitamin D, too much of it can lead to blockages, preventing blood flow to vital organs also. It can prevent the blood flow to vital organs. Which of the following organ break fats to produce cholesterol means? Here option C is the correct answer. Liver is maintain a stable pool of cholesterol, but cholesterol is also synthesized by the liver, and the liver breaks fat to produce cholesterol. So here option C is the correct answer. Next we will move on to question number 66. First drug of choice for client with epilepsy. So here client is having epilepsy. What is the first drug of choice? We will see here options. Option A, sodium valproate. Option B, diazepam. Option C, phenytoin. Option D, all of the above. For many people, very effective in controlling epileptic seizures, and for some it may be the only medication that works is sodium valproate. Sodium valproate is used to treat epilepsy and bipolar disorders. It occasionally used to prevent migraine headaches. This medicine is only available on prescription. So, sodium valproate is the first drug of choice for the epileptic patient, and also sodium valproate and phenytoin are most commonly used for treatment for the individuals with epilepsy. The current alternative to valproate, sodium valproate, in absence of phenytoin. In case the sodium valproate is not available, instead of in absence of valproate, we can take a phenytoin drug for the epileptic patients. So here the first drug of choice for the epileptic client is option A, sodium valproate is the correct answer here. Next we will move on to question number 67. Normal length of newborn at birth. What is the normal length of a newborn at birth? We will see here options. Option A, 40 to 45 centimeters. Option B, 50 to 55 centimeters. Option C, 45 to 51 centimeters. Option D, 35 to 40 centimeters. The average normal birth length is defined as the full term length of newborn, measuring 19 to 20 inches or 49 to 50 centimeters. However, a length of around 18.5 to 20.9 inches or 47 to 53 centimeters also considered as normal length of a newborn. Approximately 40 centimeters to 60 centimeters is the length of a newborn. In the first month, babies typically grow 4 centimeters to 5 centimeters plus at birth of length. Here you are having differentiation between the length in the gender. So here male babies, in a male babies we are having 50 centimeters normal length in male babies. In female babies the normal length of a female baby is 49 centimeters. So here in male babies 50 centimeters, female babies 49 centimeters at birth. Here option C 45 to 51 centimeters is the normal length of a newborn at birth. So here option C is the correct answer, 45 to 51 centimeters. Next we will move on to question number 68. Largest taste buds are. What are the largest taste buds? We will see here options. Option A vallet, option B fuliform, option C fungiform, option D none of the above. Taste buds means automatically tongue only we are having taste buds. On the tongue only we are having the taste buds. The tongue has 4 kinds of papillae circumvallate. So here we are having 4 kinds of papillae circumvallates. Here filiform follate, fungiform circumvallate, foliate papillae are found at the back of tongue and surprisingly have the largest number total buds within them. Largest taste buds are vallet, are located at the base of the tongue. They are large and round. They have several thousand taste buds. They are inverted, V-shaped, larger posterior 1/3 of the tongue. So here vallet is the correct answer. Largest taste buds are vallet. So here option A is the correct answer. Vallet is also called as papillae circumvallate. So here option A only correct answer here. Next we will move on to question number 69. Full form of AMBU. What is the full form of AMBU? AMBU. We will see here options. Option A artificial manual breathing unit, option B airway mouth breathing unit, option C artificial mouth breathing unit, option D none of the above. AMBU was originally used as the brand name for this type of device when it was first invented by Tesla Laboratory in the 1980s. The company rebranded as AMBU and the term AMBU bag has become widely used to this type of device. AMBU full form means here artificial manual breathing unit. Artificial manual breathing unit. So here option A is the correct answer. Sometimes the AMBU is called as a bag valve mask, BVM, a bag valve mask. Sometimes referred as an AMBU bag is held tool that is used to deliver positive pressure ventilation to any subject with insufficient or infective breaths. Full form of AMBU is here option A artificial manual breathing unit is the correct answer. Sometimes the AMBU is referred as name for the BVM, bag valve mask. So here first invented by the Tesla Laboratory in the 1980s. This one also very important. So here AMBU bag invented by Dr. Holger Hess 65 years ago. This one also very important. AMBU bag first invented by Tesla Laboratory in the year of 1980s and AMBU bag invented by Dr. Holger Hess in the year of 1980s, 65 years ago. So here in this full form of AMBU is option A is the correct answer. Next we will move on to question number 70. False perception without any object is known as. False perception without any object is known as. We will see here options. Option A delusions, option B illusion, option C delirium, option D hallucinations. Here false perception means delusions, illusion and hallucination. So here there is no option for all of the above are A, B and D. But here in this question only is there without any object. So here without any object false perception is called as hallucination. No doubt here Here, delusion, illusion, hallucination refers to a false perception or ideas. False sensory perception that has a complete sense of reality despite the absence of an external stimuli. Auditory and visual hallucination are most common. So here in this question, false perception without any object is known as, it is called as hallucination. Hallucination or false perception of sensory experiences. Some hallucinations are normal, but other may be a sign of a more serious condition like schizophrenia and dementia. So here the false perception without any object is known as hallucinations. So here option D, hallucination is the correct answer. Next we will move on to question number 71. The term agiospermia refers to, what is the meaning of agiospermia? We will see here options. Inability to produce sperm, option B. No sperm produced, option C. Defective sperm production, option D. Reduction in the amount of sperm. The word agiospermia is refers to a condition in which there is no measurable sperm in a man's semen. Agiospermia leads to male infertility. This may be because the man does not make sperm or because the sperm is blocked from entering the semen. The meaning of agiospermia is absence of spermatozoa from the seminal fluid or no sperm produced. So here the term agiospermia refers to absence of spermatozoa from the seminal fluid or there is no sperm produced in the seminal fluid. So here option B is the correct answer. Next we will move on to question number 72. How you identify the pulmonary consolidation from the following? As you know, how you will identify the pulmonary consolidation? We will see here options. Option A, dullness. Option B, crackles. Option C, edema. Option D, all of the above. Pulmonary consolidation describes the presence of exudate in the airways and alveoli, usually as a result of infection. Causes of pulmonary consolidation is lobar pneumonia, bronchopneumonia, fungal pneumonia, viral pneumonitis, and pulmonary edema, primary lung cancer, lymphoma. These all are the main primary causes for the pulmonary consolidation. Here the 20% of COPD. COPD means chronic obstructive pulmonary disorder or disease. The 20% of COPD patients admitted to hospitalized due to the pulmonary consolidation. We are having the 4 stages of lung consolidation. The stage 1 is congestion, stage 2 is red hepatization, stage 3 was grey hepatization, stage 4 was resolution. Here the best example for the consolidated lung is lung consolidation is when the air in the small airways of the lungs is replaced with a fluid, solid or other materials such as pus, blood, water, stomach contents or cells. It can caused by condition like aspiration or pneumonia and lung cancer. So here the consolidation, pulmonary consolidation can be identified through the edema, dullness, crackles, pneumonias like lobar pneumonia, bronchopneumonia, fungal pneumonia, viral pneumonitis and pulmonary edema. So here all of the above is the correct answer. Next we will move on to question number 73. Which is the strongest ligament in the female pelvis? From the option, which one is the strongest ligament in the female pelvis? We will see here options. Option A, oblique cervical. Option B, reverse cervical. Option C, transverse cervical. Option D, none of the above. Two transverse cervical or cardinal ligaments are most important one out of his group. They run from the lateral walls of the pelvis to the supravaginal parts of the cervix and the lateral parts of the vaginal fornix. So here transverse cervical is the correct answer. Strongest ligament in the female pelvis is transverse cervical or Cardinal ligament. The cardinal ligaments, also known as transverse cervical ligaments or magnotic ligaments, are paired structure that act to support the pelvis organs of the female pelvis. These, along with the uterosacral and pubocervical ligaments, provide support to prevent pelvic organs prolapse. Here in these options, option C, transverse cervical. Other name for the transverse cervical is cardinal ligament. So here option C is the correct answer. Strongest ligament in the female pelvis, cardinal ligament, or also called as transverse cervical. So here option C is the correct answer. Next we will move on to question number 74. Which of the following is first function of the management? What is the first function of management from the following? We will see here options. Option A, planning. Option B, organizing. Option C, staffing. Option D, directing. Planning provides basic of control. Planning is the first function of management. The other functions like organizing, staffing, directing and controlling and etc. Planning is the first and foremost function of the management. Everything begins with planning. Planning is the primary function of management and occupies the first position in the management process. Planning refers to detailed program of the future courses of action. It includes deciding the things to be done in advance. All other functions of management are based on planning only. Unless the plan is ready, other management functions such as organizing, staffing, directing, etc. will not happen. So here planning is the first and foremost function of the management. So in these options, the primary function of management means option A, planning is the correct answer here. After planning, other functions of management like organizing, staffing, directing and controlling will come. So here option A only correct answer here. Next we will move on to question number 75. Halitosis means, what is mean by halitosis? We will see here options. Option A, yellowish of teeth. Option B, bad breath. Option C, A and B. Option D, yellowish tongue. Halitosis is caused by sulfur producing bacteria in the tongue and throat. The major causes includes dry mouth due to smoking, certain foods, poor oral hygiene and coated tongue. These all are the main causes for the halitosis. Bad breath is also called as halitosis. How to reduce halitosis means brush the teeth after eating, brush your tongue, avoid dry mouth, adjust diet, regular mouth washes that contain antibacterial agents, example chlorhexidine. So here the halitosis, the word halitosis means option B, bad breath is the correct answer, caused by sulfur producing bacteria in the tongue and throat. So here option B, bad breath is the correct answer. Next we will move on to question number 76. In pediatric ward, child is anemic. Nurse should give a education about which diet? Here in this pediatric ward, the child is having anemia. Nurse should give a health education about which diet? We will see here options. Option A, rice, dal, chapati. Option B, red meat, peas, green vegetables. Option C, milk, dal, curd. Option D, potato, paneer, rice. Anemia is a common health problem in children. Most common cause of anemia is not getting enough iron. A child who's anemic does not have enough RBC or enough hemoglobin. Hemoglobin is a protein that lets RBC carry oxygen to other cells in the body. Health advice for anemic patient or anemic child by the nurse: eating iron rich foods, best source like red meat, potty, fish, shellfish. What is the normal pediatric diet means? Vegetables, legumes and beans. Cereals includes breads, rice, pasta and noodles. Preferably whole grains, lean meat, fish, poultry and or alternatives milk, yogurts, cheese and or alternatives like children under 2 should have full fat milk, but older children, adolescents can have reduced fat varieties. Here, the health education about anemia for children help to prevent iron deficiency anemia in young children. Don't give cow milk to babies under 1 year old. Limit cow milk in kids over 1 year old to less than 2 cups for a day. Giving them more can make them feel full and lower the amount of iron rich diet or rich foods they eat. If they are taking a sufficient iron food means they will reduce as a iron deficiency anemia. So here in these options, option B, red meat, peas, green vegetables is the correct answer. Next we will move on to question number 77. Who is father of anatomy? Who is father of anatomy? We will see here options. Option A, Aristotle. Option B, Robert Hooke. Option C, Andreas Vesalius. Option D, Robert Koch. Andreas Vesalius is known as the father of anatomy. He was the first to carry out dissection, closely observe the inner structure and construction of the human body. December 31st, 2014 marked the 500 years anniversary of the birth of Andreas Vesalius. Vesalius considered as the founder of modern anatomy. Vesalius is considered as the founder of modern anatomy. Who is father of anatomy means Andreas Vesalius is a father of anatomy and he is considered as founder of modern anatomy also. Here option C is the correct answer. Next we will move on to question number 78. Viruses required for growth. Viruses will require for growth. Here we will see options. Option A, animals. Option B, bacteria. Option C, living cells. Option D, plants. Viruses need to be inside a living cells to live and grow. Viruses are like photocopiers. They can make lots of copies of themselves. Once they are inside a host, viruses are cannot replicate on their own, but rather depends on their host cells' protein synthesis pathways to produce. Viruses are tiny infectious agents that rely on living cells to multiply. They may use an animal, plant, or bacteria host to survive and reproduce. As such, there is some debate as to whether or not viruses should be considered living organisms. A virus that is outside of the host cells is known as virion. So here the viruses required for growth is living cells. Here option C, living cells is the correct answer. Viruses required for growth is living cells. So here option C is the correct answer. Next we will move on to question number 79. Measles vaccine should be used within the following time after reconstitution. Here measles vaccine was reconstituted with how many hours we can use after the reconstitution. We will see here options. Option A, 24 hours. Option B, 6 hours. Option C, 10 hours. Option D, 8 hours. The reconstituted product should be discarded at the end of the immunization session or within 6 hours of opening the vial. Never freeze dilutants according to cold chain principle. After reaching the particular area, have to keep out of the box. So here in these options, after the reconstitution, measles vaccine should be used within 6 hours of opening. So here option B is the correct answer. Next we will move on to question number 80. Fear of closed spaces is called as. Fear of closed places is called as. We will see here options. Option A, xenophobia. Option B, entomophobia. Option C, claustrophobia. Option D, none of the above. We'll see one by one. Option A, xenophobia. It is fear of dogs. With fear of dogs. Option B, entomophobia. Entomophobia is also called as insectophobia. Fear of insects. is called as insectophobia or entomophobia. Entomophobia is also called as insectophobia. Next, option C, claustrophobia. Claustrophobia is fear of closed spaces. About 12.5% of the population have this fear, with the majority of them being females. Claustrophobia may panic when inside a lift, aeroplane, crowded room and other places. Claustrophobia is an anxiety disorder. Fear of closed places is called as claustrophobia. So here in these options, option C is the correct answer. Fear of closed spaces is called as claustrophobia. Next we will move on to question number 81. Father of intelligence test. Who is father of intelligence test? We will see here options. Option A, Alfred Adler. Option B, Carl Jung. Option C, Alfred Binet. Option D, Erickson. Alfred Binet, 18 July 1857 to 18 October 1911. Born Alfred Binet was a French psychologist who invented the first practical IQ test, the Binet-Simon test. Binet-Simon test ultimately came up with a test that included 30 questions, such as asking about the differences between boredom and weariness to follow a moving object with just one eye. Bonnet Simon scale and was his first recognized intelligent test, IQ test. So here father of intelligent test is Alfred Binet. Here in these options, option C, Alfred Binet is the correct answer. Alfred Binet is the father of intelligent test. Next we will move on to question number 82. The average length of a umbilical cord. What is the average length of umbilical cord? We will see here options. Option A, 35 to 40 centimeters. Option B, 50 to 60 centimeters. Option C, 60 to 70 centimeters. Option D, 45 to 50 centimeters. Cord length varies between 0 to 300 centimeters. The average length of umbilical cord is usually between 50 to 60 centimeters in the normal full-term newborn infant. Umbilical cord length varies greatly from pregnancy to pregnancy. The average was 55 centimeters long. Shortest umbilical cord was 5% of umbilical cords are shorter than 35 centimeters and longest 5% are over 80 centimeters. Here the average length of umbilical cord is option B is the correct answer, 50 to 60 centimeters. The average umbilical cord length is between 55 and 60 centimeters, and umbilical cord is considered short if it is 35 centimeters or less in length. Short umbilical cords occur in roughly 6% of pregnancies. They are risky because they can affect the growth and development of a baby as well as the outcome of the pregnancy. Here the average length of umbilical cord is 50 to 60 centimeters. Option B is the correct answer. Next we will move on to question number 83. Drug of choice for treatment in drug-induced anaphylactic shock. What is the drug of choice to treat a anaphylactic shock? We will see here options. Option A, digoxin. Option B, dopamine. Option C, adrenaline. Option D, calcium gluconate. Epinephrine or adrenaline. Epinephrine or adrenaline is the drug of choice for treating anaphylactic shock. Anaphylaxis needs emergency first aid. First line treatment is injection of adrenaline in outer mid-thigh. Do not allow person to stand and work. Give further doses of adrenaline. Dose is no response after giving a adrenaline. There is no response. Continue Repeat after every 5 minutes once. The drug of choice of treatment in drug-induced anaphylactic shock is option C. Adrenaline is the correct answer. Adrenaline has a strong vasoconstrictor action through alpha-adrenergic stimulation. This activity counteracts the vasodilatation and increased valvular permeability, leading to loss of intravascular fluid and subsequent hypotension. Drug of choice for treating drug-induced anaphylactic shock means here adrenaline is the correct answer. Next we will move on to question number 84. What is common side effects of ECT is impairment of. What is the common side effect of ECT? We will see here options. Option A throat, option B speech, option C memory, option D judgment. Many people experiences memory loss after having ECT. Some people find this only lasts for a short time and their memories gradually return as they recover from ECT. A 2017 study on 1212 members individuals who had ECT noted a decline in subjective memory in 26% of the participants. In the study, women were more likely to have a memory loss. The side effects for the ECT was impairment, nausea, headache, confusion, and fatigue, and also memory loss. So here the common side effects of ECT impairment is loss of memory or memory loss. Here in these options, option C memory is the correct answer. Common side effects of ECT. Common side effects of ECT was memory loss or impairment of the memory. Next we will move on to question number 85. Blepharitis is the, what is meant by blepharitis? We will see here options. Option A inflammation of the sclera, option B inflammation of the cornea, option C inflammation of the eyelid margins, option D inflammation of the outer canthus. Blepharitis, what is meant by blepharitis? Blepharitis is an inflammation of the eyelid that affects the eyelashes or tear production. It often occurs along with other skin conditions or allergies. The causes for the blepharitis are blepharitis happens because of too much bacteria on the eyelids at base of the eyelashes, other dermatological manifestations of the vitamin A deficiency, and inflammation of the eyelid margins. Blepharitis means here inflammation of the eyelid margins is the correct answer. Here the two types of blepharitis we are having. First one is anterior blepharitis, second one is posterior blepharitis. In anterior blepharitis, it is caused by the bacteria, and the posterior blepharitis here worsen dry eyes due to the worsening of the dry eyes is the correct answer. Blepharitis is the inflammation of the diarrhea. Option D is the correct answer. Next we will move on to question number 86. Failure of descent testis. What is failure of descent testis called as? We will see here options. Option A sterility, option B cholecystitis, option C cryptorchism, option C BPH. BPH means benign prostate hyperplasia. Here the descending of testis, failure of descending testis, a condition in which one or both testicles fail to move from the abdomen where they develop before birth into the scrotum. Cryptorchism may increase risk of development of testicular cancer, also called as undescended testicles. The cry derived from cryptorchism. In cryptorchism, the cry word derived from Greek word cryptos means hidden, opex means testicles. Most common birth defect of the male genital tract is cryptorchism. Here failure of descent of testis is called as option C. Cryptorchism is the correct answer. Next we will move on to question number 87. Tea and coffee decreases which absorption? Tea and coffee will decreases the which of the absorption? We will see here options. Option A calcium, option B zinc, option C copper, option D iron. Tea and coffee are considered the strongest inhibitors of iron. A cup of tea reduces iron absorption by about 75% to 80% and a cup of coffee by about 60%. Tea interferes with iron absorption and can lead to iron deficiency anemia. So it's best to avoid tea and coffee while eating and for 2 hours before and after the meal. Here the tea and eggs decreases the iron absorption. So here in these options, option D iron is the correct answer. Tea and coffee will decrease the iron absorption in the body. So here option D is the correct answer. Next we will move on to question number 88. How many bones present in lower limbs? How many bones are present in the lower limbs? We will see here options. Option A 20, option B 40, option C 60, option D 50. Patella, tibia and fibula, 7 tarsals in the ankle. Each limb of man has 30 bones includes femur, patella, tibia and fibula, 7 tarsals in the ankle, 5 metatarsals and 14 phalanges in the digits. The 60 total bones, 30 on each leg, allow for the ability and stand, to walk and move. Thigh has just one bone that is called as femur. So here how many bones are present in the lower limbs means option C 60 bones is the correct answer. Each limb of the man has 30 bones includes these all things: femur, patella, tibia, fibula. These all things comes under the lower limbs bones. Here how many bones are present in the lower limbs means here option C 60 bones is the correct answer. Each leg is having 30 bones. So here option C is the correct answer. Next we will move on to question number 89. In biomedical waste management, human anatomical waste collected by which color of coding bag? In biomedical waste management, human anatomical waste is collected by which color coding bag? We will see here options first. Option A red, option B yellow, option C green, option D black. The biomedical waste management, human anatomical waste will collected by in the color coding of yellow bag. Yellow category you are having human anatomical waste and solid waste. Human anatomical waste like human tissues and biopsy. Solid waste items contaminated with blood, body fluids like dressing, plasters, plasters and plaster casts, cotton swabs and bags containing residual or discarded blood and blood components are disposed of a yellow colored bag. We are having categories of biomedical waste: yellow, red, blue or white and black. Yellow is anatomical, human anatomical waste, tissues, body parts. Red biomedical waste color, contaminated waste like waste generated from disposable items such as tubing, bottles, intravenous tubes and syringes. Gloves will comes in the red color. Blue or white color, blue plastic bag consists contaminated glass. White bag consists of sharp waste including metals. Then black most consist of household general waste or garbage. These all are the biomedical waste management color codings. Here in this anatomical waste is collected by which color coding bag? according to the biomedical waste management means. Here option B, yellow color is the correct answer. Next we will move on to question number 90. Hiccups means. What is mean by hiccups? We will see here options. Option A, contraction of nose. Option B, contraction of tongue. Option C, contraction of diaphragm. Option D, none of the above. An involuntary spasm of the diaphragm and respiratory organs with a sudden closure of the glottis and a characteristic gulping sound. Main reasons for the hiccups like eating too much, being excited or under emotional stress. Hiccups are usually harmless and resolve by themselves after a few minutes. Some cases, prolonged hiccups that last for days or weeks may be symptomatic of underlying disorders. Here, hiccups means contraction of a diaphragm. Next, we will move on to question number 91. In vertex presentation, the denominator is. In vertex presentation, what is the denominator? We will see here options. Option A, bro. Option B, mantum. Option C, occiput. Option D, sinciput. During the vertex presentation, the foetal head flexes, bringing the chin to the chest, forming the smallest possible fetal head denominator, measuring approximately 9.5 centimeters. Vertex presentation is the ideal position for a fetus to be in for a vaginal delivery. In vertex presentation, the head of the fetus most commonly faces to the right and slightly to the area. The vertex presentation, the denominator is occiput. So here in these options, option C, occiput is the correct answer. The vertex presentation, the denominator is measuring the approximately 9.5 centimeters of vertex presentation. So here option C, occiput is the correct answer. Next we will move on to question number 90. Which vitamin is available in free state in nature? Which of the vitamin can free state in nature? We will see here options. Option A, vitamin B. Option B, vitamin D. Option C, vitamin A. Option D, vitamin C. The major source of our body's vitamin D comes from our own production in the skin. This requires the UV rays from sunlight to form a vitamin D3 in the body. The UV rays from sunlight to form vitamin D3. Both the liver and kidneys are needed to create the activity from the vitamin D. The vitamin D supplements are available in two forms, vitamin D2 and vitamin D3. Here, vitamin D is a hormone that controls calcium levels in the blood. Here, vitamin E is available in free state of nature. Option B, vitamin D is the correct answer here. Vitamin D is a hormone that controls calcium levels in the blood. It is needed for strong bones, muscles and overall health. So, vitamin D is also known as sunshine vitamin, is one of the essential fat soluble vitamins. It holds very high significance in helping. So here in these options, which vitamin is available free state in nature means option B, vitamin D is the correct answer. Next we will move on to question number 93. Rousing sign can seen in which of the following condition? Rousing sign can seen in which of the following condition? We will see here options. Option A, ulcerative colitis. Option B, appendicitis. Option C, Crohn's disease. Option D, gastritis. What is rousing sign? Rousing sign is used in the diagnosis of appendicitis. We already discussed related to the MC Burney's point. In the question number 5 part 1 we discussed related. about appendicitis. Here, Rossing sign also one of the sign to diagnose a appendicitis. Rossing sign is the finding of right lower quadrant pain during palpation of the left side of the abdomen, or when left-sided rebounded tenderness is elicited. A appendicitis posting Rossing sign is indicative for the acute appendicitis, characterized by inflammation, infection, or swelling of the appendix. Here, Rossing sign can seen which of the following condition means. Here, option B, appendicitis is the correct answer here. Next, we will move on to question number 94. Stethoscope is working on the principle of. Stethoscope is working on which principle? We will see here options. Option A, reflection. Option B, interference. Option C, refraction. Option D, none of the above. Stethoscope works on principle of multiple reflections of sound. Using a stethoscope, a person more than 2 feet away from the patient's chest can hear louder heart sounds than a person whose ear is in direct contact with the patient's. So, here the stethoscope is working on the principle of reflection. Heart sounds are created from blood flowing through the heart chambers as the cardiac valves open and close during the cardiac cycle. Vibrations of the structure from the blood flow create audible sounds. The more turbulent the blood flow, the more variations that get created. So here the stethoscope is working on the principle of reflection. Here in these options, option A is the correct answer. Next we will move on to question number 95. A mental process which gives meaning to the sensation. In a mental process which will give a meaning to the sensation. Here we will see here options. Option A, perception. Option B, identification. Option C, rationalization. Option D, conflict. Sensation is input about the physical world obtained by our sensory receptors, and perception is the process by which the brain selects, organizes, and interprets this sensation. Perception. What is meant by perception? Perception, the act or faculty of perceiving or appearing by means of the sense or of the mind. For example, cognition and understanding. Here the a mental process which gives meaning to the sensation means here in these options. Option A is the correct answer here. Example for the perception. The sensory experience of the world, which includes how an individual recognizes and interprets sensory information. This is also includes how one responds to those stimuli. Perception includes these senses: vision, touch, sound, smell, taste, and proprioception. So here in these options, option A, perception is the correct answer. Mental process, meaning to the sensation is perception. Next we will move on to question number 96. Temperature is maintained to preserve blood in blood banks. In which temperature we can preserve a blood in the blood banks? We will see here options. Option A, 8 degrees Celsius. Option B, 4 degrees Celsius. Option C, 5 degrees Celsius. Option D, 10 degrees Celsius. As per standard guidelines, the storage temperature for red cells is between 2 degrees Celsius and 6 degrees Celsius. For platelets and leukocytes, between 20 degrees Celsius and 24 degrees Celsius. And for plasma products, below 8 degrees Celsius. One of the main reasons of preserving blood in the standard temperature is to minimize the bacterial growth. If blood is kept beyond the higher defined limit, even for a short period of time, the bacteria that are infiltrated into the blood from the donor will quickly grow and propagate. The red blood cells are stored in refrigerators 6 degrees for up to 42 days. Platelets are stored at room temperature in agitators for up to 5 days. Plasma and cryo are frozen and stored in freezers up to 1 year. Here the temperature is depending upon the different type of blood bag. So here the blood in the blood banks temperature is maintained in preservation of blood in the blood bank is 4 degrees Celsius. So here option B is the correct answer. Next we will move on to question number 97. Antibodies are produced by. We will see here options. Option A, plasma cells. Option B, erythrocytes. Option C, lymphocytes. Option D, basophil. Antibodies are naturally produced by plasma cells within the human body to mediate an adaptive immune response against invading pathogens. A lymphocytes is a type of WBC that is part of the immune system. There are two main types of lymphocytes, B cells and T cells. B cells produce antibodies that are used to attack invading bacteria, viruses and toxins. So here lymphocytes is the correct answer. Antibodies are produced by the lymphocytes. B cells and T cells. The B cells produces antibodies that are used to attack invading bacteria, viruses and toxins. Here antibodies are propounded. So here antibodies are produced by the lymphocytes, T lymphocytes and B lymphocytes. B lymphocytes, B cells produce antibodies that are used to the attack invading bacteria, viruses and toxins. So here antibodies are produced by option C, lymphocytes is the correct answer. Next we will move on to question number 98. Local cold application transfer heat from the body by. The local cold application transfer heat from the body by. We will see here options. Option A, radiation. Option B, conduction. Option C, evaporation. Option D, vasoconstriction. Heat is lost from the body chiefly through conduction, convection, radiation and evaporation and constriction of the peripheral arterioles. Application of heat and cold influences dilatation of constriction of peripheral blood vessels. Example for cold application includes ice packs, ice massage and ice baths. Lowers temperature of the skin and underlying tissue and causes vasoconstriction. Here the local cold application transfer heat from the body by conduction. So here in these options, option B, conduction is the correct answer here. Next we will move on to question number 99. Disulfiram. What is meant by disulfiram? We will see here options. Option A, inhibits aldehyde dehydrogenase. Option B, inhibits alcohol and dehydrogenase. Option C, both A and B. Option D, none of the above. Disulfiram is used to treat chronic alcoholism. It causes unpleasant effects when small amounts of alcohol are consumed. These effects include flushing of the face, headache, nausea, vomiting, chest pain, weakness, blurred vision, mental confusion, sweating, choking, breathing difficulty and anxiety. Here the diffaldehyde is also called as DSF is presently on only available drug used in the aversion therapy of recovering alcoholics. It acts by inhibiting ALDH. ALDH means aldehyde dehydrogenase, leading to high blood levels of acetaldehyde. So here inhibits aldehyde dehydrogenase and inhibits alcohol dehydrogenase is the correct answer. Both option A and B is the correct answer here. Next we will move on to question number 100. This is last question in the second set of model paper. The commonest manifestations of endometriosis. The commonest manifestations of endometriosis. We will see here options. Option A, pain, infertility. Option C, bleeding. Option D, A and B. Endometriosis is different, endocardiosis is different. Endocarditis and endometriosis both is different. Endocarditis is inflammation of the heart valve. Endometriosis, here in this question, endometriosis is a disorder in which tissue similar to the tissue that line the uterus grows outside the uterus in places where it doesn't belongs. Endometriosis is a disease in which tissue similar to the lining of the uterus grows outside of the uterus. Here endocarditis means related to the heart valves. Endometriosis means related to the uterus. Endometriosis, we will see now endometriosis clinical manifestations. The clinical manifestations like pain, infertility, painful menstrual cramps that may go into the abdomen and lower back pain. So here in these options, commonest manifestations for the endometriosis is pain. In these options, option A is the correct answer. Pain is the commonest manifestations of the endometriosis. Here in these options, option A is the correct answer. Commonest manifestations of endometriosis is pain. In case endocarditis, a common clinical manifestation like aching joints, muscles, chest pain when you breathe, unexplained weight loss, blood in urine, chills, fever, persistent low-grade fever. These all things clinical manifestation of the endocarditis. But here in this question, endometriosis is there. The common manifestation pain, infertility, painful menstrual cycle and painful cramps that may go into the abdomen and lower back pain. So here in these options, option A is the correct answer here, pain. This is last question in this part 3 related to the model paper for the staff nurse 2023. This is second set. In upcoming classes we will discuss third set of model paper in upcoming classes. Thank you so much one and all for watching my video. Anybody here watching first time my channel, please subscribe my channel, click on the bell icon for further notification, and please share your opinion in comment section. Please share the video to your friends. Give a like while watching a video. Stay tuned friends. Thank you.